To our audience and global audience, and welcome to the Government Information Center. I'm Selima Shimoefeleni Masipa. We gather under the theme From Stigma to Strength, Many Shades, One Voice. On behalf of the Namibia Institute of Pathology, in collaboration with the Department of Dermatology at the Windhoek Central Hospital, under the Ministry of Health and Social Services, I warmly welcome you to today's program in commemoration of World Vitiligo Day 2026. Now, allow me to introduce our distinguished guests who have joined me in studio today. They are Dr. Nita Haitembu, who is a dermatologist at the Windhoek Central Hospital, and Dr. Nambumba Amondaba, an anatomical pathologist with the Namibia Institute of Pathology, who unfortunately, due to work commitments, had to excuse herself. And we are also joined by Ms. Namutenya Shiyagaya, who will be joining us virtually, and she will share her personal journey with us today. Ladies, thank you so much for joining us, and welcome to the Government Information Center.
Thank you.
All right. Let's start at the beginning, Dr. Haitembu. Now, for the viewers who may not be familiar with vitiligo, what exactly is vitiligo?
Okay. Vitiligo is a skin condition where the skin loses its color and it presents with patches that are pale or white compared to the normal skin color of the patient.
Okay.
This disorder is not contagious, and the disorder itself can present itself anywhere on the skin. It can occur on everyone of any age, and it is usually an acquired disorder. People get it later in life. It's very rarely a congenital disease where a baby is born with this condition. It's not common presentation of it, so therefore it is acquired.
Okay.
And this disorder, the way it is, it's due to the destruction of the melanocytes. Melanocytes are skin cells that produce the color. These melanocytes are just not on the skin. They are also found elsewhere in the body, but the one that we are talking about today are the one on the skin, because those are the ones that produce what we see for patients with vitiligo.
Okay, thank you so much, Doctor. Now, just to give a bit of background, today, the 25th of June, marks World Vitiligo Day, and a global observance aimed at raising awareness about vitiligo, promoting understanding, and addressing the stigma and discrimination associated with the condition. So, as you said to us, Doctor, vitiligo is a chronic skin condition characterized by the loss of pigment-producing cells. And this year's theme challenges us to move away from stigma and move towards acceptance and resilience and empowerment, and recognizing the dignity and strength of those living with the condition. Now, the purpose of today's session is really just for us to discuss and increase public awareness and understanding of vitiligo, correct the myths and the misconceptions, while also promoting acceptance and inclusion, and just provide expert insight into diagnosis and management, and then also just get a lived experience from those living with the condition. So maybe let's just run back to maybe if you can just give us a brief understanding of how common is vitiligo in Namibia.
Vitiligo, let me start by saying we don't have the national statistics of vitiligo in Namibia. But based on the statistics that we took at our hospital, the Windhoek Central Hospital Dermatology Department, in 2025, we looked at the consecutive number of patients that we have seen for 9 months. And there were about 7,000. And out of those, that the patients we have seen in total, there were 7,000, but out of those, 70 were diagnosed with vitiligo. But now this ties in with the prevalence of vitiligo worldwide, because worldwide, vitiligo affects about 2% maximum of the population. Although different parts of the world, you find that, especially in Africa, some statistics are showing that it's a bit higher than 2%, but worldwide, it's about 2%. So if we have about 70 patients out of the 7,000 that we have seen, that goes roughly around 1%. So it means that it's probably, the prevalence is probably just the same as it's seen elsewhere in the world. We still have to compile the statistics then of the national statistics for Namibia.
Okay, thank you so much for that overview, Doctor. Now, maybe let's shift from the clinical perspective to the human experience. Ms. Shiaraya, thank you for joining us.
Thank you very much for having me.
All right. Now, can you maybe just give us what is your experience have been, or what has your experience been living with vitiligo?
Thank you very much. Okay, so I've been having vitiligo for 8 years, and I got it when I was 28. I just noticed like a small part of my skin becoming a bit lighter, and it just started spreading. But I was like so concerned, like what is happening? And later on, it started spreading, but I'm like, okay, but it's not paining. It's not itching. I'm not seeing any skin going off. So then I started making my own information. I went on Google and started like typing like, oh, skin peeling off. I'm like, but no, my skin is not off. And I was like, then vitiligo popped up on the screen. And I started reading. I'm like, everything that they've been explaining is what I'm experiencing. And but rather than that, it was just skin peeling, like skin changing, but not paining. No pain, no nothing.
Okay, thank you so much for that. Maybe, Dr. Haitembu, you could just give us an overview of what are the medical conditions that are commonly associated with vitiligo.
Okay. There are a couple of disorders that can be associated with vitiligo. From the explanation that I gave of vitiligo before, is that there's destruction of these cells, the melanocytes. So it is actually the immune system, a person's immune system, that is destroying the melanocytes. But what we realize with this condition, as the immune system is destroying the melanocytes, these people are also susceptible for other autoimmune conditions. So there are thyroid disorders. Patients with vitiligo can have thyroid disorders. They can also have systemic lupus erythematosus. Those are some of the conditions that patients with vitiligo can have. But there are a few more, even rheumatoid arthritis, inflammatory bowel disease. Sometimes they might even have a constellation of symptoms that we call, like they might have a metabolic disorder, metabolic syndrome. So there's many other conditions that are associated with this disorder. Sometimes they might even have eye issues and even the ears. Like I said, these melanin or pigment producing cells, they are not only found in the skin, they can also found in other parts of the body. So yes, there are many other conditions, but even for the skin, you find that there are also other conditions on the skin that are not vitiligo, that can also be associated with vitiligo. For example, these patients might have what we call a disease called alopecia areata, where just out of the blue, the patient is losing hair. So they might also have conditions like psoriasis. So there are many other conditions that can actually be associated with vitiligo. So it is the duty of a diagnosing doctor, as they see the patient, to first of all diagnose the disease and search for other symptoms and other signs in the patient that could be associated with those disorder, because in this patient there could be other diseases. Yeah, so vitiligo is not just what we see on the skin, but most importantly, and I must not forget this,
Okay.
because of how the patient looks like, it also induces a lot of depression and anxiety in the sufferer. Although there are some other theory that perhaps, apart from that, the fact that of the anxiety and the depression that comes from the fact that the patient has this visible disease, there could also be maybe a biological connection that can explain what is happening. Like, for example, I say this disease is really like it's systemic. There is something else that is happening. Is it the depression and the anxiety? Is it just because of how patients are perceived and how they look at themselves? Or could there be also a biological explanation that we can give why these patients are also predisposed to developing this disorder?
All right. Thank you so much, Doctor, for that in-depth analysis. And about speaking what you just told us about, that really ties into the lived experience. Maybe we can just cross over again to Mashiara, and she can also just speak to us about the challenges that she's faced and the experiences as an individual, what she's gone through living with vitiligo. Mashiara?
Okay, so the challenges that I have experienced is whenever you meet people, could be for the first time or people that
I
know
can't hear
you
her.
before, can you guys hear me? Hello?
I can't
Can
hear.
you hear me?
I can't hear. So,
Okay.
Mashiara?
Can you hear me? Yes, ma'am? Can you hear me?
Yes, sorry. We can hear you now.
Okay.
So, as I was saying, Mashiara, Dr. Haitembu really delved in and gave us an in-depth analysis. Maybe you can just give us what it was like or what it is like and what challenges you faced, and just from your personal experience, if you can just run us through that.
Okay, the challenges that I have experienced, it's whenever you meet a person for the first time, or maybe people that known you before, their reaction, they always like scared, or like they don't want to touch you because they think it's contagious, or maybe they ask like, oh, were you witch? Those type of words from the community, like from some people, really makes us feel very bad, and to a point that there was a point that I wasn't confident, and to a point that I had to cover like myself with makeup just to hide my my skin condition. So sometimes it really hurt, and then I had to go seek for therapy. And the good thing is therapy really helped me mentally, and the family members gave me that courage. Like, no, you actually look beautiful like this. So sometimes the way people react to people that have vitiligo, it's actually not good, because we tend not loving ourselves inside, and then we are shy. So that plays mentally, like inside. Yeah.
Definitely, mentally, it really does play on a person. I think we can all understand that coming from any perspective. I'd like to bring in Dr. Nambumba Amundaba, who's an anatomical pathologist with the Namibia Institute of Pathology. Doctor, welcome.
Thank you so much. Good morning.
Good morning. Good morning.
Thank you for having me.
You're welcome. So let's just delve right into it. Can you tell us more about what role pathology and the laboratory services play in this process of confirming vitiligo for a patient?
Thank you so much. As Dr. Itembo has previously mentioned of the conditions that some of the patients suffer from, so what they usually do, or what they usually do as the clinicians, they do take some bloods. So now some of those bloods, they do send them to our lab, which is the Namibian Institute of Pathology, whereby we can test for the lupus, the systematic rheumatoid arthritis, and also for some of the conditions like for thyroid function tests. So they send them to NIP, which is to our lab, so that we can test them, so that they can actually diagnose these cases, these conditions. So that's in terms of the blood that they do. So in terms now when the dermatologist actually takes a biopsy from the patient of the area where there's that white patch, where the skin has lost its pigmentation, they send it again to the lab, and that's where us as the anatomical pathologist usually we come in, whereby when we look at this skin, we look at it under the microscope, we're actually looking at the number of melanocytes. And usually there is a reduction in the number of melanocytes, or there is actually absence of melanocytes. So sometimes when we also do levels on this skin biopsy, and we also do special tests of immunohistochemistry, which we call S100, melan A or SOX10, to look for the melanocytes if they are present or absent. So when they are absent, and also compared with the morphology, we give a diagnosis like that. It actually favor or it's a vitiligo. And then our dermatologists, they usually receive these results now for the Namibian Institute of Pathology. So that's how actually the lab comes in to assist our clinicians in diagnosing vitiligo through their blood results and also through our biopsies that actually sent to NIP.
Wow.
So in short, that is what the Namibian Institute of Pathology assists the dermatology department, the clinicians with that.
All right.
Yes.
Wow, that was really... Dr. Haitembo, what other conditions may be associated with vitiligo? Can you maybe just give us the rundown on that?
Oh, okay. Yeah, there are many conditions. I can group them. Sometimes they are the one that we see on the skin, not vitiligo, but the one we see on the skin, like where they lose hair. We call it like alopecia areata. That is one of the common diseases that they can have. But then there are also other disorders, the systemic disorders, the autoimmune condition. We can have thyroid disorders. We can have even diabetes, especially type 1. We can have rheumatoid arthritis. We can have something called pernicious anemia. There are really many diseases. Systemic lupus erythematosus. One has to also screen that they don't have a metabolic syndrome. There are actually many diseases. Even with the eyes, sometimes they might have problems with the eyes. We have these melanocytes, sometimes also in the ears. So it's beyond just what we see on the skin. Sometimes there's other associations inside the body, and we have to screen for those. Not every patient we are taking blood. We have to first make sure that there are signs, there are symptoms that can support us to, or that can compel us to test if we have those. And yes, like doctor said, then there are times when we even have to, sometimes you doubt the diagnosis, if this is also just vitiligo, because there are other conditions on the skin that can look like vitiligo, but they are not vitiligo. Some of them can be skin cancers, and some other disorders that are infectious, and some other ones that are not necessarily infectious, but they are not vitiligo. So if we are doubting it all, that's when we take a sample, we send it to Dr. Amundaba or the pathologist, and then they confirm. But largely, we can make that diagnosis of vitiligo clinically.
Okay. Could you maybe also just elaborate on what medical treatment options are available?
Yeah, now there are very many different options that we can give for patients with vitiligo. So when we see the patient, how we manage them, first of all, you have to be confident of the diagnosis and of exclusion of all those diseases that we diagnose. Then we can do medical treatment. You can give topical treatment where we just give creams and ointment that are applied on the patch where the problem is. But then there are times one can also combine the treatment with light therapy.
Okay.
Yeah, we have various therapies and lasers that we can give, like phototherapy or the laser, that can also be combined with that.
Okay.
But there are also other systemic medications or treatment that we can give to the patients.
Okay.
The one that they take inside, they drink, like in terms of perhaps tablets. Do you understand?
Okay.
So, but all these things, it's especially the systemic treatment, is best done by people who really understand what they're doing, because these treatments are also not without side effect.
Yes.
So one has to make sure that you monitor these patients, you encourage them to come back for follow-up. Yeah, and yes, of course, then, if we pick up that it weighs heavily on their mental health,
Yes.
we refer them for psychosocial support in the hospital.
Okay. Thank you so much, Doctor. Maybe just to give us a bit more there, how important, when the patients are going through this therapy, how important is it for psychosocial support for the patients when they go through the treatment and the therapy? What psychosocial support do you guys offer?
Okay, I'm now talking from our hospital, Felix
Yes.
Central Hospital. We have a huge psychosocial department, the mental health hospital. People don't like to use that term, but yes, mental health is a real issue, and we have a huge department. We have the social workers who are also part of that. We have the psychologists, and we have the psychiatrist. If the patient is really depressed and they need that therapy, then they go for that. So we encourage them. I remember an example of a young child who was brought to the clinic because of vitiligo. And unfortunately, vitiligo, like I said, it can go anywhere. This was now on the genitals. And the mother felt maybe something happened to the child. Maybe the child was raped. So, first of all, you have to clear that to make the mother understand. And now you can see, especially in the children, now we have two patients. It's a child, but when it's on the genital, kids are not usually then stressed because they don't say anything. But the mother, who feels like the child was raped, you have to deal with that. And if they are depressed or stressed, you have to refer them to a social worker to also investigate why perhaps they are questioning that, because that's an issue on its own. And if they are more stressed and the social worker can't deal with that, we refer them on to the psychologist, and they might pass them on to psychiatrist if it leads to that.
Okay.
But I also have a case of a young child at school, because now vitiligo was on the face, and often vitiligo can occur on the face, especially with the children. It likes around the orifices, like where there are holes, like around the eyes, around the lips. So now this child comes, the major issue now is bullying at school. So she was so bullied, and it was bad. The child is sitting there crying. So I had to refer the child again for a social worker who did a very good job, because with on the follow-up, the girl was different, smiling, went to school. I had to write letters to teachers so that they can also explain to other kids in school what is happening to this girl. It's not her own doing. She was called names. And there's also another theory where we believe that when the patients are stressed, it can actually make the disease itself worse. Yes. So it can actually spread much more quick. So psychotherapy, it actually should be made as an integral part of managing a patient with vitiligo. And sometimes you may not pick up. Sometimes you may not pick up that the patient is so stressed. But it's important that you just mention it to them that should they feel stressed, there is help out there. And it actually helps also with the progression of the disease. So it is very important.
Okay. Thank you so much, Doctor. So it just goes to show that psychosocial support is really important. And then this just ties into a question that I have for Dr. Mundaba. Are there any promising developments or ongoing research in the field towards the treatment of vitiligo? Is there any promise? Is there any hope? What does it look like? What does the future look like in terms of pathology there?
So for pathology, there is obviously research going on, and currently, for me as the pathologist, and also with the dermatologist. We want to do research, but for in Namibia, because of the stigma that goes on, just to correlate with the usually the biopsies that we get. For example, the race, where it's mostly commonly affecting the Namibians, and also in what population. Is it mostly the kids, or is it the adults, or in also what area, region of Namibia? So we are busy with that research, which hopefully will kick off soon, whereby we involve both correlation between pathology and the clinical side of vitiligo, and also to see in Namibia what we are going to come up with after this research. With the treatment, there is some treatment going on in the world, but I think for treatment, Dr. Itempo, she's touched that on it, or she has more info on it, on the current treatment research that they are doing on treatment for vitiligo. But for us as Namibians, the research that we are doing in collaboration with dermatology is for us to find mostly in the age, the race, and mostly in Namibia, which regions are mostly affected by this. Because as you know, some of us are also, although we do not have it, we've got family members that are actually suffering from it, and whereby they face a stigma in the community, and mostly it's associated with witchcraft, or they say it's chronic alcohol use. So we grew up with watching these things, but as we've grown up and we've become health professionals, doctors, we understand the condition. Hence now as we've grown up and we are able to make change for our population, for the Namibian nation, we are doing collaboration between pathology and the dermatology department, so that we can see what statistics are going to come out of this.
Okay. Wow, thank you so much. Ms. Shiara, maybe you can also just come back in. Can you maybe just tell us how you've managed your condition?
So I've been recently going to the hospital. There's some good help at the state hospital. And therapy also helps. Because starting this year, I have noticed that there was like some few patches on the other side of my cheek. And then I was a bit worried. And I went to the hospital, to the state hospital, at Central Hospital. And I got some lotions to apply. And it actually helped. Because I saw it different, because it didn't actually spread. Because on this side where you see, yes, so that's going to take a little time. But where I noticed it started spreading, it stopped. So there is help. And going to the state hospital helped. Any hospital you can go. And therapy helped very much.
All right, thank you. So basically, you're just reminding us that vitiligo is not just a medical condition, it's a human experience, and it really just calls for empathy and understanding and just inclusion for the wider population and Namibia at large. So really, each of us really has a role to play in eliminating the stigma, really, and just supporting those affected, like our guest, and embracing diversity in all forms, really. Just to close off, ladies, I would just like to get each of yours insights on what more needs to be done and how we can support, or how the systems can be strengthened in support for those living with vitiligo. Dr. Mundaba, maybe you can come in there.
Okay, thank you very much. So I don't know if you remember last year. Last year it was only the pathologist who was on this platform from the lab perspective, and then we decided that this year we are actually going to include in our dermatologist from the Windhoek Central Hospital, so that they can also just give insight more, and also to bring in a patient who's living with this condition. And next year, the plan is between collaboration of the Ministry of Health from the Department of Dermatology and also as NIP with patients. We are hoping that there's going to be a support group for actually patients living with vitiligo. But we want this support group to be driven by the patients themselves that are actually suffering from this condition. Also with plus family members that have are also associated with these patients that are suffering from vitiligo, whereby this support group will include social workers, some of the medical doctors that will be helping these patients, and also the lab, so that together with this support group, we can make the patients to feel that they are not alone, and also to make more people aware in Namibia that this is not witchcraft, it's not alcoholism, but more of a medical condition. So we are hoping next year we have some patients in the studio with us, and then they can talk more about the support group. So we're really hoping that with Dr. Nathan Nitembo, this support group is gonna kick off, and by this time next year, in 25 June 2027, we'll be able to sit with these patients. And remember, on such a day in 2009, we lost such an important icon in our lives, Michael Jackson. I'm sure everybody knows him. He was
Definitely.
suffering from vitiligo, but for the longest time, we thought he was actually using the bleaching creams because he wanted to change his skin color and who he is. But in actual fact, it was not. It was just because there was not awareness around it. It was actually vitiligo. And hence also why the commemoration of the 25th of June, it's World Vitiligo Day, because of also the pop icon of Michael Jackson, who was suffering from that. So essentially, from this we want to come up with a support group, but which we want to be driven by the patients who are suffering from that condition.
Okay, touching on that support group, Ms. Shiara, maybe you can, are you part of a support group? Maybe you can just give us your insights and what it is being part of that community, the support group, and what support you get from that community.
Okay, I'm not yet on a support group, but I am on a, how should I say, when people see you and then they notice how confident you are, the surrounding becomes breathable. And that support that you're getting from everyone and educating people that are asking you questions actually brings me peace. In the support group, I think that will be a good thing. Because a lot of people, parents that I meet, they ask me questions about, they picked up something, their daughter is also having maybe like a vitiligo, just for them to be informed, like to be a bit educated about it. I think the support group will be a good thing.
Basically, you're just letting us know that we should embrace your diversity and all those
Yes.
who have the condition, just to embrace the diversity and make them feel part of the community and make them kind of give that oneness. And then with these
Yes.
groups that Doctor is talking about that will be created, this will really just create a safe space for you guys to communicate, speak about your challenges that you guys go through, and just to know that it's okay to have vitiligo and it's not a death sentence or anything. I mean, you can
Yes.
live normally, and it's just
And the thing is, like, sometimes people think that, oh, vitiligo, you're born with it. No, I got it at the age of 28. You might get it later on at the later stage at 40. So being educated about it, you can get it at any age, any skin condition can get it. So a lot of people need to be educated about that. So opening up a support group to inform people about and educate them about this will be a good thing.
this year, one voice. Let me go back to it again. One voice, many faces. Can you maybe just delve into that into your closing remarks? What does that mean for you?
One voice and many faces. Okay. What I would like to say about that is that vitiligo, let's come with one voice, that vitiligo is a disease that is known scientifically, and a lot of research is made into that area to really work out why this disease. And based on that, research are also continuing to actually get targeted therapy. So vitiligo is not witchcraft, it's not a curse, it's not HIV. Some patients also suffer, they are told that they have HIV. Vitiligo is not caused by anybody's fault. Like Ms. Shiaga put it correctly, it can happen to anyone, anytime. So anyone is at risk of that disease. So, and it comes in different shapes, because it affects people differently in different way. And yes, there is help, but even reaction to treatment can be variable. So we can't say because maybe patients have it, they go for treatment, then immediately they get the response to treatment. There are those who get good response. There are those who also don't get good response to the treatment. But there are other ways we can help the patients live with this condition. So let's come with one voice and stand up and say, patients who have vitiligo, they did nothing to get this disorder. And let's support them. Let's show them empathy. Let's hug them. Let's touch them, because I sense that my patients sometimes they come and they just appreciate that I touch them barehanded, because even at home, no one wants to touch them because they have fear that it's contagious. So, and we must understand, it's not just on the skin. It can be inside, but more so the inside is the mental stress, the distress that it can cause.
Okay.
So let's stand up and say, patients with vitiligo need our empathy.
Yes, so basically let's just hold hands and let's support them and back them up and just give them the support that they need. Dr. Amundaba, just before we close off, what more needs to be done? What more can we do as a nation, as doctors, as the people living with the condition?
What I would suggest is that I think number one on the research, but the most important one is the support group, because currently there's no support group for our Namibian population or our patients. So we are going to give out some numbers, or one can go to the central hospital at the dermatology department, whether you are a family member, so that then you get more information on the support group that's going to be formed. So that in this support group, we are going to, Mishiagaya, she's already, although she is saying she does not know, she's not part of it, she is going to be part of it, and those are people who are going to be leading this campaign, to teach them, to make people aware. As you can see, she's so comfortable in her skin. And if she's telling you the story of the baby and me and her met, we met at the car, I took in my service. Then I told her, do you know that your condition can be treated? She was not. Then she came to Central Hospital, not to a private hospital, our Central Hospital, at the dermatology clinic. So she's going to be one of the people to campaign to be part of this support group, whereby in this support group now we support both adults and young children. And these are the people who are going to be leading. And us as the professionals, health professionals, will be in the background to support them. And hopefully also NIP will be supporting this support group, because I'm part of the NIP, and also the Ministry of Health will be supporting this support group, so that we can make our patients, you see, the day we have World Albinism Day and there's a support group. Now also for vitiligo, we are going to have such a group for our patients, to cater for our patients with vitiligo. But together with the Ministry of Health, with our doctors from the dermatology department, NIP, and our patients who are suffering from that, or the family members who wish to be part of that, because we also require a lot of voluntary work. Because if we have to travel, for example, to make people aware during campaigns, we also need family members to pitch in, whether it's the parents of the children or whether it's the family members, brothers and sisters. It's going to be for everyone. Nobody should feel left out.
Yes.
As our,
Yes.
may so rest in peace, our president used to say. Dr. Hani Dinko. So, yeah. I
Yes.
say ideally, that one is the most important one. And
Yes.
then we do research also us as Namibians, because there's no research being done currently in Namibia from us as health professionals. Hence, us now with the pathology and our dermatology, we are going to do research to get more the statistics of Namibia, the Namibian population.
Yes.
Yes.
Thank you so much, Doctor. Ms. Shiara, I think in conclusion, you've really just heard that the Namibia Institute of Pathology, as well as the Department of Dermatology at the Windhoek Central Hospital, have just really reaffirmed their commitment to educating, to supporting you and people in the community living with vitiligo. And really, it's just for us to continue to transform the stigma into strength and just ensure that your voices, Mashiach, are really heard and valued and respected. So I'd just like to thank our panelists and our audience and everyone who has made today's session possible. And from myself, Selima Shumwefeleni Masipa, and the entire production crew behind the scenes, it's goodbye for now and happy World Vitiligo Day 2026. you.